Let's conclude with lesson 6 on abnormal psychology. And today we are looking at trauma and stress related disorders. So this is lesson 6. Yes, the lesson is coming from this book entitled Abnormal Psychology, which I've written, and it's where now the detailed notes are on this lesson. So if you want to know more about what we are learning or what we are talking about, you should get this book and you get the information that you need to get. So lesson 6, we are looking at trauma and stress related disorders, and we are going to look at definitions and symptoms of trauma and stress related disorders. We're going to look at causes and risk factors for trauma and stress related disorders, and we are going to look at treatment options for trauma and stress related disorders. This is your host, Dr. Tilipo Mfumbo. You can order or contact me by commenting, or you can also do any of our programs. We have got varieties of programs from business, education, and different programs. So you can contact me on +260 976 1812 53. +260 976 1812 53. Yes. So let's dive into the course, and I encourage you to stay tuned up to the end of this lesson. The other thing is that if you like the video, just uh, like it, and also leave a comment. If there is anything that you would want us to improve, you can also comment. Definition. Trauma and stress related disorders are a group of mental health conditions that occur in response to experiencing or witnessing a traumatic event or experiencing chronic stress. So when we talk about these disorders, they have to do with experiencing or witnessing trauma. What are the symptoms of traumatic or stress disorders? Number one, fresh back. That is whereby a person becomes baby when they remember what happened. They they become so emotions because of what has happened. What happened? There is vivid, distressing memories of the traumatic event, where the memories are not giving good memories, and they are bringing traumatic. You are being traumatized by the memories. Then it can also come out in nightmares, recurring nightmares related to traumatic events, where a person is having some nightmares because of what happened. So you begin to experience dreams of negative dreams, or dreams about the similar event happening to you. So that is a traumatic disorder. Then avoidance of behaviors, avoiding people, places, or activities that remind them of the traumatic event. So they are whereby you begin to avoid places, behaviors, or people that reminds you of that traumatic event. So those are the symptoms when a person, I know I don't like going to this place. I don't like visiting these people. I don't. So when a person is saying that, then that person is going through what is called traumatic disorder, which is the mental health. Then others they experience what is called hypervigilance, whereby they are being alert. They are so being constantly on guard or alert. It's like they are so much sensitive. That is also uh, part of traumatic behavior or traumatic mental illness. Then emotional dysregulation, whereby a person is failing to regulate his emotions. They cannot control their mood. They can't control their emotions. So that is also a symptom. So the causes traumatic events. This experiencing and witnessing a traumatic event such as physical or emotional abuse, natural disasters or combat. For example, if someone is involved in an accident or survives from an accident, they may have those traumatic uh, illness, mental illness. And the others, it's because maybe you have just witnessed a bad event where you saw maybe something something unthinkable happening. They may cause that traumatic. Maybe you were tortured, so that creates a traumatic disorders. Then chronic stress, experiencing ongoing stress or significant life changes, whereby you experience the divorce and that has left a certain challenge in your mind and you fail to cope up with that. So when you look at that, it just brings you back. So even if you get into another relationship, still you look anything that happens, you are traumatized, you are afraid of something to repeat itself. Family history and genetics also they create such uh, uh, reasons of why people get into that. Brain chemistry, imbalances of neurotransmitters also is one of the reasons why people get what is called traumatic event or traumatic behavior or traumatic uh, challenge, which is a mental challenge. You know, when the brain and when the neurons are not functioning well in the body because of imbalances or they are unable to transmit proper information to the brain, you may experience this traumatic behavior where a person just becomes afraid of nothing. So the risk factors are previous traumas, experiencing previous traumatic events where you experience an event that you which was so traumatic to you. Lack of social support, lack of support from family and friends can create traumatic um, disorder where you feel neglected. Personality traits, there are personality traits that has got that has got these challenges like those that are perfectionists, like the melancholies. They intend to they become traumatized by maybe failing to reach the perfectionists, failing to reach the standards they want to reach. So it may create that. Then also there are those the pragmatics where they become because they are afraid of they are ashamed or afraid of people, so they feel maybe what I did was not a right thing, so they begin to be traumatized. Then there is also the health condition which may cause that, and also there are medicine that may cause stress. Um, Also, like sometimes it's also persistent pain and all that. When you just think of the pain that you went through, you are traumatized. So that is those are the things that creates that. Then we have got what is called the how do we handle these or what therapy can be used in this type of challenge or psycho challenge, or what is called uh, the therapy that can be used when you are facing traumatic uh, disorder. Number one, you may be so the therapy that can be used, like psychotherapy, you use the counseling in trying to help this person to cope up and to help these people or this person to know that things happens in life and they sometimes don't come back. So you help individuals change negative thought pattern and behaviors. Then trauma focused therapy, which is a type of CBT specifically designed for trauma and stress related disorder. Eye movement and desensitization and reprocessing, a type of therapy that helps individuals process traumatic. Uh, you let this person say, look, are you seeing what can as are you seeing what happened, or do you think these things can occur? Why do you think they can occur? What can be uh, the cause for them to occur? So you help that person to do that. Then there is also medications. Sometimes they just need to have what is called antidepressants, which can be applied so that this person depression and anxiety is regulated by the antidepressants. Then there is also anti-anxiety medications also, they also help in reducing. So you refer this person to the medical practitioner for them to for the psychiatric to be able to apply the medication to this person. Then sleeping aids, there are also some medications like Valium which can be applied in order to help this person improve sleep disorder, or help this person be able to be in a relaxed mood through sleep. Then there is lifestyle changes also can help. Mostly when we are talking about the mental disorders, which is it's in abnormal psychology. The therapies may be the same or related in all kind of mental illnesses. So let the people do the exercise which may raise their self-esteem and also uh, be able to, when they become tired, they concentrate on the doing exercises, it may also help. And also there are some psychotherapy exercises where they should which has to be done. Relaxation techniques, that is deep breathing, and also muscle relaxation, meditation, uh, just to be present at the moment, where the person should focus on the present, not in the past or in the future. You just let them know that it's today, it's not yesterday. They are not living yesterday. So the challenges of yesterday should not be brought into today. Then social support, connection with friends, family, and support groups. They also, it can be used like pastoral care and counseling. Alternative therapies, mindfulness based on therapies that focus on mindfulness and relaxation. Let them just help them to be in a place where they can be quiet. You just give them, you just sit with them and just tell them to close their eyes, breathe in, and just be quiet. Just to be on the mindfulness and present moments. Art therapy, that a type of therapy that involves using art to express emotions. When we talk about art therapy, that is where you can just play music, and the music that is going to give them the courage, and the music that is going to tell them you can overcome, such kind of music that is going to raise their emotions, and they feel they are above the circumstances. There is what is called animal assisted therapy, a type of therapy that involves interacting with animals to reduce stress and anxiety. So this is where now they are playing with animals, and also like where you just take them for, they just involve themselves in games and being with people. The other one, it is, as I said, it's a spiritual therapy whereby a person is involved in church programs, religious activities, and also prayers, and where a person have prayers, fastings. When a person is fasting, it also brings that person to be present. So all that. Okay, congratulations. We have reached at the end of our program. You have completed abnormal psychology. So, well, what I've just given you, it is a tip, and you need to take interest to research as a learner. Um, don't forget to get this book, Abnormal Psychology, which may be so much helpful for you to, as a psychologist or as a person uh, that is a practitioner, or even when you are just not a practitioner, so that you may be able to know and to help many people. Thank you so much, and God bless you. Let's continue researching and doing what is necessary. In this world, there are a lot of challenges, and there are a lot of abnormal issues. There are a lot of mental disorder. So we need you to be able to be there to help people. They say that no one is perfectly normal. So, in one way or another, each one of us experiences such abnormality in the psychotic abnormality. So, we need to encourage many people, and also you can share uh, this video. Ensure that many people learn from what goes on in the mind, and how they can be able to cope up with some mental challenges. Thank you once again, and God bless you.